The Health Ombudsman has found that medical negligence led to the death of Shonisani Litole, who was admitted to Tembisa Hospital last year. The Ombud revealed that the 35-year-old was not fed for several days and has called for disciplinary action against 19 staff members and the accounting officer. Litole died before receiving his medical results, which showed that he had tested positive for COVID-19. Now, days before his death, the businessman took to social media to reach out to the Health Minister, Dr. Zweli Mkhize, about the conditions at the hospital, saying he was being starved.
I make the following further recommendation, that in the light of these wide-ranging findings that I've spoken about, of the food, the medical care, the tests, and the SARS-CoV tests and others, and the clinical records of the hospital, I make a recommendation that really the accounting officer has to be taken to a disciplinary process for really running the state of affairs that is almost as it was. He really sidelined, I think, proper processes. He sent me and Dr. Bandile Masuku the wrong information that he signed for. There were notes that, as I say, of doctors that were missing that he never reported and never alerted us to them, and I think that should have been a courtesy, something at least to say, I'm sending you this, but there are these defectives, and he never did that. We also believe that the Gauteng Department of Health and Tembisa Hospital should undertake disciplinary process against 19 staff members that you can characterize them as medical doctors, people that are in charge of food, and the nursing staff.
The Ombudsman explained that Litole's life could have been saved.
The medical care that was rendered to Mr. Litole was categorized as substandard by almost every witness that we interviewed. But it has lots of elements of medical negligence that were found by the Health Ombudsman. Our findings were confirmed and corroborated by Dr. Nwata, who is now the new head of internal medicine at Tembisa Hospital, and Dr. Farid Abdullah, who is an independent expert who looks after COVID patients at Steve Biko Hospital. And what he was given was the clinical records of the patient. He never interviewed anybody. He never visited the hospital. He just came to his conclusions from the clinical records that he examined. The same happened, I think, with Dr. Nwata. She never saw Mr. Litole. She just was given the clinical record, and of course was given my preliminary report. However, she went further to say that Mr. Litole's mortality was both avoidable and preventable, because he was a young man at 34 with no comorbidities. If you want to look at the report or the reports, I've put the pages there for ease of reading. The third finding deals with the clinical records. Really, these were described as defective. They were described as appalling. They had lots of falsified descriptions. Some days were missing records. Some were untimed, unsigned, illegible, and the records of the doctors were missing from the 23rd, 25th, 28th, 29th, and 30th.
Professor Malegapuru Makgoba added that the Tembisa Hospital is not fit to be classified as a provincial tertiary hospital.
Tembisa Hospital is classified as a tertiary level hospital. I believe it should not, it doesn't fit that level. It should be reviewed. I also don't think that the hospital was ready for the COVID hospital, despite the fact that when Mr. Litole was admitted, we were already 3 months into the pandemic, and there had already been several warnings about what to do in this pandemic. The way I believe systemic facts falls in Tembisa, I don't think anybody doubts that, and they are recorded in our findings. However, the management of the establishment had not done their job, and I think it comes through everywhere in the report. More importantly, I think individual healthcare professionals involved in providing care also failed to discharge their responsibility, and their conduct could not be explained by the broader systemic defaults.